Hi, I'm Dr. Siegel. I'm a nephrologist at University of Michigan Medicine and spend a good portion of my clinical work with individuals who are living with chronic kidney disease and doing dialysis, both in-center and home dialysis.
Hi, my name is Karen Crampton. I'm a social worker with University of Michigan Medicine in their home dialysis program.
Today we're going to be talking about choosing dialysis options. Selecting a treatment for kidney failure can sometimes be a challenge since the goal is to try and match the type of treatment for kidney failure with lifestyle options and taking into account other medical conditions that you may have. Today we're going to primarily be talking about hemodialysis and peritoneal dialysis, the two major forms of dialysis that people need to choose from. Toxins and waste products can build up in the bloodstream and cause what are called uremic symptoms. That is, problems with energy and fatigue. Sometimes there's poor appetite, nausea, and upset stomach. Some people have problems with fluid retention where they get swelling in their ankles or might have shortness of breath. And when these symptoms progress and in the setting of very low levels of kidney function, it's time for us to start dialysis. Hemodialysis is a process where we take blood out of the body, we run it through a filter, and that blood then is returned back into the body. The process of hemodialysis helps remove these extra toxins and waste products and extra fluid and helps restore some normal balance to the blood chemistries and electrolytes. In order to do hemodialysis, we need to take two needles and insert them into a vein in the arm. One needle takes blood out of the body to run through the dialysis filter, and the other needle returns the blood back into the body after it's been cleared of the toxins and waste products. The dialysis machine has a pump that pulls that blood out of the body, pushes it through the filter, and then returns it back to the patient. When people go to a center for hemodialysis, they typically have treatments 3 times a week. So it's either Monday, Wednesday, and Friday, or it's Tuesday, Thursday, and Saturday. The average treatment time is typically 3.5 to 4 hours. And most dialysis clinics will have 2 or 3 shifts. There's often an early morning shift that may start at 5:30 or 6 in the morning. There's a midday shift that might start around 11 or 12. And some units will have a late afternoon shift that might start anywhere from 3 to 5 p.m. When patients go to a center for hemodialysis, they are assigned a specific day and time. So for example, it might be Monday, Wednesday, and Friday at 3:15 in the afternoon. And that's like a standing appointment that the dialysis facility is going to want patients to keep on a regular basis. When patients are receiving dialysis, during the treatment, people may listen to music, watch TV. Most dialysis clinics have internet access, and some people will sleep during a portion of their treatment. In order to get blood out of the body, we need to have what's called an access for the dialysis treatment. The veins that we have in our arm, while we can draw blood from them or put an IV in to administer fluid or medications, aren't big enough and don't have enough blood flowing through them to support the hemodialysis treatment. So we asked the surgeons to create what's called a fistula, which is a direct connection between the artery that's traveling down towards the hand and the vein that's returning blood from the hand back to the heart. You can see in the schematic on the top that there's a small connection between the artery and vein. And that allows some of the blood that's traveling down towards the hand to make a U-turn and head back up in that vein. Over time, the vein in the arm will get larger in size, the walls will get thicker, and more blood will flow through the vein. And that allows us to then put 2 needles in it to do the hemodialysis treatment. In the bottom picture, you can see a picture of someone's arm with the wrist on the one side and the elbow on the other. And there's a vein, their own vein, that's larger in size, and you can see on the forearm. And that's the spot that we'll use to put needles in for the dialysis treatment. Creating a fistula can be a time-consuming process. Typically, the surgeons will start with an ultrasound of the veins and arteries in the arm to get a roadmap of what they have to work with. After surgery, under the best of circumstances, it can take 2 months before that vein is large enough in size for us to be able to use it to do dialysis. Sometimes people need to have additional procedures or even additional surgeries to help that vein, what we call mature, so that it's in a position that we can use it. So we like to start this process of creating a fistula when the kidney function is typically around 15% of normal or less. Certainly for people who need to start hemodialysis abruptly, where they may start with a catheter, we would want to get people in to see the surgeons relatively quickly. Not everybody has great veins to work with for a fistula. They may have had lots of IVs or procedures. They may just have small veins to begin with. The surgeons can place an artificial vein called a graft in the arm to use as an alternative if people don't have good vessels to use for a fistula. So during that initial consultation with the surgeon, and after they see the results of the ultrasound, the surgeon can decide and talk with you about what the best option is going to be for a dialysis access. I want to take a few minutes and talk a little bit about some of the pluses and minuses for hemodialysis and why some people might choose one form of treatment over another. With hemodialysis, some people indicate that they really enjoy the fact that there are trained nurses and dialysis technicians who will do the treatment for them. So as long as they're able to get themselves to the dialysis clinic on time, all they need to do is sit back and the treatment will proceed by trained professionals. Some people enjoy the regular contact that they have both with the dialysis clinic staff, the nurses and technicians, as well as physician or advanced practice professionals who are also in the dialysis clinic seeing patients. Many dialysis facilities will have a physician or nurse practitioner or physician assistant swing by to see people on a weekly basis. And while many people acknowledge that coming to the dialysis unit can sometimes be a burden, there are 4 days off that people don't have to do anything in regards to their kidney failure and treatment. So it's a 3-day on, 4-day off treatment cycle. There's no equipment or supplies that need to be kept in the home when people choose hemodialysis. And although problems that come up during dialysis are rare, there's emergency help that's available quickly if needed. Some of the downsides to think about when considering hemodialysis at a center is the need to travel back and forth to the clinic 3 times a week for treatment, and that treatment is on a relatively fixed schedule. Sometimes people feel worn down or tired after their dialysis treatments, and they need to go home and have some recovery time. That may be one of the biggest difficulties that people who do in-center hemodialysis describe, is the part where they just don't feel so great afterwards. Typically on the non-dialysis day, most people indicate that they feel back to their usual self and are able to do their typical daily activities. Nobody likes needles, and hemodialysis involves placing 2 needles into the vein in the arm 3 times a week. There is a product that helps numb up the skin. It's a topical anesthetic that can be used to take the edge off of putting the needles in. It doesn't make it completely painless, but it can help people get through that initial part of the treatment. Once the dialysis needles are in the fistula and the treatment's up and running, most people report that they don't have any discomfort from their arm. One thing to consider with hemodialysis is that the diet or nutrition plan is somewhat restrictive. People often need to be very careful about the amount of potassium that's in their diet, as well as their fluid intake, since any of the fluid that people consume between treatments often is removed by dialysis on the following treatment. Although most people get through their dialysis treatment without any difficulty, sometimes people will have symptoms like headache or cramping, particularly if we try and take too much fluid off too quickly. Usually we can address those symptoms relatively quickly and get people feeling better again. I'd like to talk a little bit about how peritoneal dialysis works. Peritoneal dialysis is another way of filtering the toxins and waste products out of the blood and works quite differently than hemodialysis. Peritoneal dialysis is a process that uses the peritoneal lining, which is a thin membrane that surrounds our abdominal cavity, and has a lot of blood vessels in it, a very rich vascular supply. During peritoneal dialysis, excess fluids and waste products are also removed from the body, but we're using that peritoneal membrane as a filter. We're sort of repurposing it to do that task. In order to do peritoneal dialysis, we take a dialysis solution and put it inside the peritoneal cavity or the abdominal compartment. So instead of taking blood out of the body to run through a filter like we do in hemodialysis, we take the dialysis solution and put it in the abdominal compartment and use it that way to filter the blood. So we need a catheter to allow us to get fluid in and out of the body. We use a soft, flexible catheter that the surgeons place, often laparoscopically. One end of the catheter goes through the skin, typically just below the belly button and off to the side. The part of the catheter that's inside the abdominal cavity sits low down in the pelvis, sort of around where the bladder is at. The other end of the catheter sticks out, typically about 9 to 12 inches. In the picture here, you can see someone who's pulled up their shirt and they're holding out the catheter with the end capped off. Some people will put a small dressing over the catheter exit site on their skin, although that's not necessarily needed. When the catheter is placed, we often let it heal up for 2 to 4 weeks before we start to use it to do the peritoneal dialysis. People will secure the catheter either by taping it to their skin, or some people will use a belt that they wear underneath their shirt that has a sleeve that the catheter can be tucked into. There are a number of different ways to secure the catheter so that it's comfortable and people can go about their day-to-day activities. Most people indicate that once the catheter's in and it's healed up, they don't notice it too much once it's secured and they're out and about. I'd like to explain a little bit about how we use the catheter and the dialysis solution to perform peritoneal dialysis. In the diagram, the blue bag is fresh dialysis solution that hasn't been used, and the yellow bag has dialysis solution that's been in the body and it has the toxins and waste products in it. Typically, we'll connect a bag of dialysis solution to the catheter. That dialysis solution goes into the abdominal compartment. It sits for a period of time, and while that fluid is sitting, the toxins and waste products are moving from the blood into the dialysis solution. After that's happened, that used dialysis solution is drained out into a collection bag. In the simplest case, we will perform this exchange of fluid 3 or 4 times a day. That might be once in the morning when somebody gets up. It might be a second exchange midday, a third exchange perhaps around dinner time, and then one last exchange before bedtime. In the step-by-step process, by starting with connecting up the peritoneal dialysis system to the tube, we allow the existing fluid that's in the belly to drain out and remove the toxins and waste products. That takes about 15 minutes to drain the fluid out. We then fill the abdominal compartment with the fresh dialysis solution. That's a little bit faster and takes maybe 10 or 12 minutes to fill up. And then the system is disconnected and the fluid sits in the belly and the dialysis process begins to happen. While people are doing peritoneal dialysis or doing their exchange, which probably takes about 40 or 45 minutes from start to finish, people can read, watch TV, listen to music. You don't necessarily have to be sitting down, although most people are when they're doing the exchange. Many people will do the exchange of fluid at home, although it is possible to bring these bags of solution, and we've had people do them at work in the office. You could even potentially do it in a car as long as you can practice good hand hygiene and wear a mask. The used dialysis solution can be discarded down any household sink, tub, or toilet drain. So this is not biohazardous waste that needs any kind of special handling. Although we often start with what's called continuous ambulatory peritoneal dialysis, the manual exchanges that I was just talking about, most people prefer to use a machine to do the dialysis treatment for them at home at night. So this is called automated peritoneal dialysis or sometimes continuous cycling peritoneal dialysis. But the idea is that you can connect the peritoneal dialysis catheter up to a machine shown here, and then while you sleep at night, the machine will fill the belly up with fluid, let the solution sit for a period of time and drain that solution out. And it will perform these exchanges of the dialysis solution multiple times over the course of the evening. Many patients can get most or all of their dialysis done at night while they're sleeping at home. Peritoneal dialysis is a daily therapy. So it's done 7 days a week, 365 days a year. So there aren't days off from the peritoneal dialysis like there are in hemodialysis, but with getting therapy done during the nighttime, it is an efficient way of dealing with kidney failure. Most people are on the cycler from anywhere between 8 to 10 hours on average. Sometimes people will need to do an additional exchange of fluid either when they finish up with the cycler or sometimes in the middle portion of the day. One of the things that's nice about peritoneal dialysis is there's a lot of flexibility in terms of how the specific prescription is developed. So based on what's important to people in terms of trying to maximize the time on the cycler at night versus some flexibility with doing some exchanges during the day, we can typically come up with a peritoneal dialysis prescription that's going to work for each individual based on their own circumstances. The tubing that connects the patient to the peritoneal dialysis cycler is a little over 20 feet in length. And so once hooked up and the treatment started, there is a set amount of space that you have to move around. But with careful positioning of the cycler in the bedroom, many people who have an attached bathroom can make it into their bathroom if they need to, or move around their bedroom freely. When people are doing peritoneal dialysis, you don't have to be lying down in bed. People can sit up at a desk or in a chair and move around freely while the treatment is going on. In terms of training or learning how to do peritoneal dialysis, we typically will spend 3 or 4 days teaching people how to do these manual exchanges for peritoneal dialysis. Since most people want to advance on and use the cycler to do their treatments at night, we'll typically spend another 3 or 4 days teaching them how to use the cycler. I think the most important part to remember is that we don't make a decision to send somebody home to do their peritoneal dialysis until they're 100% comfortable and confident that they can do these treatments safely. And we need to be also 100% comfortable and confident that the patient can do these treatments. So while these are average times to learn how to do the treatment, we individualize the teaching. Some people need a little bit more time. Some people can get away with a little bit less time, but it's really a joint decision about when it's the right time to go home and be able to do treatments independently. When patients are doing peritoneal dialysis, we see them once a month in our clinic to check in and see how their treatments are going, make sure that they're doing well. During those visits, people will meet not only with their dialysis doctor or nephrologist, they'll also meet with the nursing staff, a social worker, and a dietitian. So these are fairly long and comprehensive visits that we do on a monthly basis. We have dialysis staff that are available during the day to help answer questions or troubleshoot any problems. There's also an 800 number that's available 24 hours a day if there's technical problems with the cycler machine. I'd like to talk a little bit about some of the pluses and minuses of peritoneal dialysis. One of the things that's nice about doing PD at home is that there's a fair amount of control and flexibility with the dialysis schedule. There's no set time that you have to be on the cycler at night or an exact time that exchanges have to be done during the day. So it gives people a bit more flexibility in trying to work dialysis into the rest of their lives as opposed to scheduling their lives around their dialysis treatment. Many people who do peritoneal dialysis report that they tend to have more energy and feel better, particularly than when compared to hemodialysis. Although we see people once a month for a clinic visit, after training, there's no need to travel back and forth to the dialysis unit like there is with hemodialysis. PD is really an opportunity for people to be involved in their own care and feel like they're in the driver's seat for their treatment. And it provides more continuous therapy similar to your own kidneys. Peritoneal dialysis has a bit more flexibility with a nutrition plan or diet. Specifically, people don't have to limit the potassium in their diet the same way that they do with hemodialysis. And there's a bit more latitude in terms of how much fluid people can drink during the day. Again, from an efficiency standpoint, most of the therapy can be done while you're sleeping at night, which frees up the daytime to do really anything other than dialysis treatments. Peritoneal dialysis is safe to do at home by yourself. No partner is needed, although it's always nice to have some additional support. We do have people do peritoneal dialysis who live alone and are completely independent. Some of the downsides with peritoneal dialysis, it's daily therapy, and so there aren't days off in the schedule from it. It does require a catheter that gets inserted into the abdomen. I think it's important to understand that with both peritoneal dialysis and hemodialysis, we need to do a surgery to have access in one way or another. So with PD, it's a catheter that's in the belly. With hemodialysis, it's a fistula in the arm. I don't think there's clearly a right or wrong or a best case here, but I think it's important for people to understand that when they do dialysis treatments, we're going to need to change their body with a surgical procedure in one way or another. With peritoneal dialysis, sometimes we worry about a potential risk for infection called peritonitis, where bacteria can potentially get into the abdominal compartment. That risk is a bit higher if there are cats in the home. Cats can bite the peritoneal dialysis tubing and have a type of bacteria that are in their mouth that can cause problems. As long as cats are able to be kept out of the bedroom when PD is happening at night, typically don't have problems, but we like to mention that ahead of time for all those cat owners out there. With peritoneal dialysis, it's a dextrose or sugar-based solution that we use to filter the blood and remove fluid. And that means that some of that sugar is absorbed into the body. So with peritoneal dialysis, you get a couple hundred extra calories a day that nobody's really asking for. That means that with peritoneal dialysis, there is the potential that some people could gain weight. For people who are living with diabetes, we'll often need to make adjustments in their medication regimen to account for that extra sugar that they're getting with the PD treatments. With peritoneal dialysis, there are supplies, primarily the peritoneal dialysis solution, that need to be stored in the home. There will be cases of solution that get delivered typically on a monthly basis. The delivery service will bring the cases of solution and supplies into the home and set them up where you'd like, and will help kind of rotate the stock and help manage that. For some people, having those supplies in the home is a reminder that they're living with a chronic illness, and people do need to have adequate storage space for those supplies. And the last thing to be mindful of with peritoneal dialysis is that there are some restrictions in terms of swimming. Freshwater, lakes and rivers, we really discourage people due to potential risk for infection. The same is true for hot tubs. However, salt water is okay. So if you're planning a trip to the ocean, that's fine with peritoneal dialysis, or if you have a saltwater swimming pool. And some discussion probably needs to happen around a well-chlorinated swimming pool. So I think if people swim regularly for exercise and enjoyment, PD may not always be a great fit, but there are ways to help people swim occasionally and still do peritoneal dialysis safely and successfully. I'd like to talk for a minute about why some people might choose to not do dialysis. If kidneys fail completely and we don't do dialysis, then people will ultimately pass away or die from their kidney failure. Although nobody really wants to do dialysis, many people will at least try dialysis for a period of time to see if it can help them live more healthy and feel better. Sometimes when people have kidney failure, they also have other major medical problems that are having a bigger impact on their quality of life and perhaps even their longevity. So sometimes people feel like even if they were to do dialysis, it's not going to help them feel better or live healthier or even potentially live a lot longer. And in that situation, we would have a conversation about doing conservative therapy, so still addressing symptoms and managing other problems that come up with kidney disease as best we can with medications and other techniques, but not pursuing dialysis. In that setting, usually we'll help refer people to palliative care and hospice for additional support in managing their symptoms, and we'll continue to follow them to offer support in any way that we can. Sometimes when people start dialysis, at some point along their journey, they find that the burden of doing dialysis outweighs the potential benefits. And so anywhere from 20 to 25% of people who are doing dialysis long term will make a decision to stop dialysis therapy, even though it means they'll ultimately pass away from their kidney failure. And that setting also will refer people to hospice care to help support them with symptom management in the end of their lives. I'd like to talk a little bit about some of the common questions that we hear as people are approaching the need for dialysis. And probably first and foremost is the question about when exactly is it time to start dialysis? Nobody wants to start dialysis any sooner than we absolutely have to. And typically we see that the kidney function is around 10% of normal. So if you're following along with that glomerular filtration rate or GFR number, when the GFR is around 10, that's the average level of kidney function when people are needing to start dialysis. But beyond just the numbers, it's also really based on symptoms of kidney failure. There's two main areas that can get people into trouble and push us towards starting dialysis sooner rather than later. That first area is related to nutrition. So at low levels of kidney function, many people report that their appetite isn't as good as it used to be, and they may go from eating 3 meals a day to 2 meals a day to just 1 meal a day. Oftentimes, people report that food doesn't taste the same or they have a funny taste in their mouth. And sometimes people will have problems with upset stomach, with nausea, maybe even have dry heaves in the morning. In that setting, people are at risk for becoming malnourished and losing weight. And so when we see that progression of symptoms, that can often be an indicator for us that it's time to start dialysis to keep people from becoming malnourished. The other big area that can sometimes push the need for dialysis relates to their fluid balance and volume management. In the setting of low kidney function, the kidneys often have a difficult time getting extra salt and water out of the body. We can use diuretics or water pills to help the kidneys get out extra water and keep blood pressure under control. But sometimes at very low levels of kidney function, even if we go up on the dose of diuretics, people still retain fluid. So we'll see worsening problems with swelling or perhaps difficulty with shortness of breath. We'll see blood pressure that becomes more difficult to control. And sometimes in that setting, the only way we can return that fluid balance back towards normal is with starting dialysis. While we're doing these educational sessions to help people make the best decision possible before they need dialysis, sometimes people change their mind after they've made one of these decisions. And so we'll often encounter people who start out with hemodialysis by going to a center 3 times a week. And at some point down the road, they may decide that they want to give home dialysis or peritoneal dialysis a try. And it's absolutely okay to switch from one to the other. Similarly, we may have people who start out on peritoneal dialysis and either run into difficulties or decide it's not a good fit for them, or maybe their home situation changes. And they also can switch by going to hemodialysis in a center. So we try and help people make the best decision possible, but we understand that situations change as time moves on, and just know that switching therapies from one to another is absolutely a possibility. In Michigan Medicine, we have a large number of kidney doctors or nephrologists that work in the health system. And not all of our kidney doctors follow patients on dialysis. So we like to try and let people know ahead of time that they may be seeing a kidney doctor who wouldn't necessarily follow them after they start dialysis treatments. So it's important to ask your kidney doctor that if you do need dialysis in the future, whether they would be the one who would follow along with you or whether you might be assigned to a different kidney doctor. If you're interested in learning more about peritoneal dialysis, we offer an education session in our peritoneal dialysis clinics. This includes some one-on-one time with our nursing staff to see the setup, the cycler machine, the bags of the dialysis solution, what the PD catheter looks like. And it's a chance to help practice making the connections with the tubing and really getting a better understanding of how peritoneal dialysis works on a day-to-day basis. So if you're interested in learning more, I would encourage you to discuss with your kidney doctor about setting up one of these education sessions in our dialysis clinic. If you're potentially interested in hemodialysis, then having the discussion with your kidney doctor about the timing of having that fistula surgery will be an important next step. I'd like to turn things over to Karen Crampton, one of our social workers, to talk a little bit more about some tips towards helping people cope with advancing kidney disease and making that transition to starting dialysis.
Hi, my name is Karen Crampton. I'm a social worker with the home dialysis program at Michigan Medicine. We acknowledge that starting dialysis can be a difficult time. So one of the most important things that I talk to patients about is their self-talk. What is it that the patient or you are telling yourself about your situation? Because that really matters. Are those thoughts helping you or are they hurting you? And sometimes you have to take a little bit of time to think about what thoughts are kind of going through your mind. So often we tell ourselves things that we would never tell someone else, things that are less than supportive, things that maybe cause more worry. So I encourage you to take stock and think about what it is that you're telling yourself and give yourself some time to shift those thoughts. Think about things you might tell someone else to be supportive and provide encouragement, and adopt those thoughts for yourself. And one of the ways I can get to that is thinking about asking patients, do you perceive dialysis as an obligation or an opportunity? Because the patients that I've worked with for years that do really well are the ones that perceive dialysis as an opportunity. It's an opportunity to spend time doing things that are important to you, to maybe travel, to go to school, to further your career, whatever it might be. People that do the best are the ones that perceive dialysis as an opportunity. And those that perceive it as an obligation make adjustment to dialysis more difficult. So it comes with a sense of weight when you think about it as an obligation. Spending a little bit of time thinking about how you might shift your perception and your thoughts. And then next is acknowledging a new normal. And you may have heard that. I hear that fairly often. And it's really taking time to say, my life might be different because I have to spend this time doing dialysis, because either way, it's a time commitment. And thinking about what are some new goals. And maybe your goals remain the same because maybe dialysis doesn't impact it as much as you might think. But I would also encourage you to think about new life goals and thinking about what's important to you, and sort of accepting that it might look different than you envisioned, because nobody ever wants to do dialysis, but at the same time, it gives you an opportunity to pursue your goals. So think about ways that you can live your life in a satisfying way. Also, communication is really important, staying connected with the people that are supportive of you. And oftentimes when you don't feel well, you don't feel inspired to maybe meet someone for dinner or go have coffee or have people over. But oftentimes when you push yourself that little bit to stay connected, you will come home and say, I'm really glad that I did that, and feel a sense of support and feel maybe a little bit restored. So I encourage you to stay connected with people that are good for you, that are supportive, and otherwise it's too easy to become isolated. And the last point that's a tip for coping is education. And we think about education as an opportunity to conquer some of the fears of the unknown when you don't know maybe what's coming your way. So I would encourage you to get as much education as you can from reliable sources, places like the National Kidney Foundation. They have a website. Home Dialysis Central has a website. American Association of Kidney Patients. Those are all reliable sources to get more information about what you learned about today. Thank you. I want to invite a special guest today and express my gratitude for a patient who's willing to join us today to talk about his experience doing peritoneal dialysis.
And I'm Bob Armstrong. I'm a retired biochemistry professor. I taught at University of Michigan for 6 years and Albion College for 27 years. I've been a part of the dialysis experience for 3 years since I started dialysis.
I'll start with the first question as we educate patients about the different treatment options for kidney failure. And the first big question is, how do I know which one is right for me? So I would like to ask you, was it a hard process to learn to do peritoneal dialysis?
For me, it was not a hard procedure at all. My experience as a scientist may have helped some. The main thing is one has to be careful to keep everything sterile that you do. You don't want to get an infection. And I've gone 3 years with no infection, so that has been effective.
Okay. How well does that seem to, the dialysis, doing it at home, how well does that seem to fit into your lifestyle?
It fits me very well. Talking with friends who had been on the hemodialysis, where every other day they're getting dialysis, they said, I finish the dialysis, I'm whipped. I have to go home and rest. So you've lost that whole day. Many times the second day, they don't feel all that great.
How has it helped you do the things that you want to do?
Well, in the past year, I have taken 2 cruises. I've taken a vacation to Florida for 5 weeks. So obviously I've been able to continue, for the most part, the same lifestyle that I had beforehand. Only things that I haven't been able to do is to swim or to use the hot tub, because I do not want to get any chance of infection where the tube exits my belly.
And how do you feel throughout the day?
I feel the same whether it's morning or night. It's not like what I've heard my friends say who were on hemodialysis, where they felt wiped out after the dialysis session. I don't feel any ill effects before or after. I don't feel ill before I start dialysis, and I don't have any weakness or anything following. Since I do it every day, I think that helps to keep the body on an even keel.
What's it like to do dialysis at home day to day?
It's a procedure that you have to get used to. It does take some time. It takes about an hour in the evening to set up, get everything together. In the morning, taking blood pressure, temperature, blood sugar. The machine asks for all of that data each morning and night. That plus the machine emptying the excess solution takes another half hour. So I probably spend an hour and a half to 2 hours every day on routine matters with regard to the machine and the procedure.
And how well have you adjusted to that?
I've adjusted to it quite well. I sleep through most of the time. My tube placement was such that if I'm sleeping on my left side, my tube doesn't allow me to drain very well. And so my machine will beep, beep during the night. If I turn over to my right side, it drains fine. The machine shuts up. I go right back to sleep. Many times, I don't even wake up to do it. I just automatically do it.
So it sounds like you've figured out what works for you.
Right. I've really not had any difficulty adjusting to the machine and to the routine. It was very easy to make that adjustment. And as I mentioned earlier, I feel the same morning or night. I don't have that wiped out feeling that I hear that some of the patients on hemodialysis have experienced.
So what's it like having a catheter?
No hot tub, no swimming. It's one of the things that I had to give up with the catheter because you do have that tube coming out of your belly, which should not be submerged in water. Some people say, oh, you can't take a bath. Well, my bathtub, I can't get the water high enough to reach the catheter before it reaches the overflow drain. So I don't have to worry about that. If I want to take a bath, no problem. I can take a bath. I've never gotten water in the catheter.
Can you feel that the catheter is there?
I don't feel the catheter. I bought a series of belts that have a little pocket in them, so the end of the catheter slips right into that pocket. It's not flopping around. It's not tugging at the exit site. And so I use that belt for sleeping, and I have not had any problem as I roll over or sleep with it tugging the catheter.
Oh, good, good. Can you tell me a little bit about what it's like to manage the supplies that come to your home?
We were fortunate to have a small bedroom with a sliding glass door going out onto my screened-in porch. So it was very easy for the delivery men to bring the supplies in. They're very good about rotating supplies. So the old boxes they put out front, so they're used first. I get about 40 boxes a month. That's a pretty good pile. The boxes are about 8 by 8 by 16, and they weigh about 35 pounds. I went to Florida this year for a 5-week period, and fortunately I rented an apartment, or a little apartment, and it had a tiny bedroom. But the landlady was willing to have Baxter come deliver the material on Friday before I came on Monday, so that I didn't have to worry about my supplies not arriving in Florida. They were there on Friday before I got there on Monday. So the supplies take up a good deal of room. Baxter is very good. I put in an order about 2 weeks, and I just simply tell them I have 16 boxes of yellow left. I have 7 boxes of green, and so on. And they know from that how many boxes to ship me.
So they help you with the ordering process.
They are very good at helping me with the ordering process, yes. Had an interesting situation on the cruise that I took that started from Canada. Canada uses a 5-liter bag. United States uses a 6-liter bag. And so my machine had to be reprogrammed for that vacation for the 5-liter bags, so that I did not have the machine malfunction with a smaller bag.
Yeah, I think leaving the country sometimes has different nuances, doesn't it, that have to sort of be thought out. And I guess you learned that, so that the next time you leave the country, we'll be prepared. So thinking about being asleep while you're on the machine, because you're on the machine for a while, if you're not asleep that whole time, are you able to do other things?
Oftentimes, I will hook up the machine, let's say at 10:30 at night. I don't want to go to bed till 11:30. I can have enough tubing to reach from my bedroom out to my easy chair in the living room. I sit there and I read.
So you don't have to stay in bed the whole time?
No. I don't have a TV in my bedroom. I can watch TV from my easy chair, obviously. So that works as well.
What do you do if you needed medical help from your dialysis team? How do you handle that?
I have had occasion when my machine will malfunction. Usually, of course, it happens at 11 o'clock at night. Mm-hmm. And Baxter gives a person an emergency number, and I call that emergency number. A technician there, with my help, we look at the machine, we get the serial number. They can walk me through what is wrong. And nowadays, I've reached those situations, I can fix it myself for the most part.
Great. How often do you have to go to the clinic for appointments?
I have an appointment at the clinic every month. At the clinic, I see 4 different individuals. Karen is one for social work. I see a dietitian. I see a nurse, and I see a physician. I'd like to put a plug in for the group at the center in Eisenhower. I think they're super individuals. They're very friendly. And even the receptionist got to know my name very quickly. That receptionist left, a new one came in, and again, very friendly, very upbeat, knows my name right away, greets me by, "Hello, Mr. Armstrong," and it goes from there.
How does that help you to have such a strong connection with your team?
Well, I think it gives me confidence that I'm getting the best treatment possible. Sometimes we don't like to go to the doctor to get medical treatment, but here's a chance to get treatment with pleasant individuals. You actually look up to saying hi to them and greet them each time that you go there.
Well, we are happy to see you each time as well. Well, those were my questions, and I'm just wondering if there's anything that you would like to share that maybe you wish you knew as you were deciding or as you were starting peritoneal dialysis that might help people feel more comfortable with what lies ahead for them.
Well, I think one of the things, and I didn't have this, is doing this kind of interview where a patient can actually tell them what to expect and how to solve it. I talked with one family where they had to make the decision in the next week because they were either going to have the tube placed or they were going to get a fistula to look toward hemodialysis. And I talked with them on a telephone for probably an hour, and they said that it was very worthwhile to them, that they learned so much that they were glad to have that as they made an important decision.
And I think that's a great way to end our interview because it's how we started, which is you're the most important part of our education because it helps people have hope for the future. It helps reduce fear. And both of those things increase the ability for people to learn. And those are invaluable gifts that you give people. So thank you again. I really appreciate your time today.
It's been fun.
Hi, Crystal. Thanks so much for taking the time to chat with us today. Maybe you could just start out and tell us a little bit about your experience with kidney disease and the whole trajectory that you've had with dialysis and kidney transplant.
I've had chronic kidney disease since I was about 25. So it's been about 14 years now that I've been dealing with that. And I've had a transplant. And then I've been on hemodialysis, and I recently started peritoneal dialysis.
So you're doing peritoneal dialysis now. Tell me a little bit about the decision-making process. Since you've done hemodialysis in the past, what was it that drew you to doing PD most recently?
So I chose PD because it allows me to have a little more freedom throughout the day. And also hemodialysis requires you to be in the center for 3 days a week for about at least 4 hours each session. And also it makes you feel really tired afterwards. Like I didn't have a lot of energy to do like even my daily chores or whatever. So when I started PD, it gave me more freedom to be at home with my family and do things that I enjoy. And it also gave me more energy because I was less fatigued as opposed to hemodialysis.
That's great to hear that you're feeling better. Maybe you could talk a little bit more about what it's like kind of on a day-to-day basis for you to do the peritoneal dialysis, because you're doing that every day as opposed to just the 3-time-a-week treatments that you were doing for hemodialysis. So what's that like for you on a day-to-day basis?
Yeah, so for in a day-to-day, it kind of just like became part of my normal routine, just like if you would wake up and brush your teeth or wake up and get coffee. So I usually would set up my machine around 7 p.m. It allows me to have time to cook dinner and get my kids prepared for school while it's priming. And then by around 9:30 bedtime, I just hook up to the machine and I'm good to go for the rest of the night. Just can relax or sleep through, and in the morning I disconnect and go about my day.
That's great. And so is there time where you're hooked up to the cycler where you're not in bed sleeping? Do you do anything else while you're getting your dialysis done? Tell us a little bit about that.
Yeah, so while I'm hooked up to the machine, I'm able to, sit and watch TV, enjoy TV if I want to. I usually have my cycler in my room, so I'm able to move about throughout my room, clean up, fold clothes, do daily chores I need to. It depends on how long the patient line is, but you can go to the bathroom or whatever other room that you can reach to when you're attached to the machine. You're free to go about.
Okay. And how difficult is it for you to set up the machine? And you mentioned you set up your machine a little bit early, then go off and do other things. What's that whole process like?
So initially, when you first get the machine, it looks kind of intimidating because there's a lot of lines and stuff that have to be connected. But the training that I had at the dialysis center and the nurses, they were very, very informative, and they helped me to make sure that I felt comfortable before I went home on the machine. So the setup is pretty simple because the machine actually tells you step by step what to do as you go about. You just basically I would open up a cassette. It tells you to place the cassette and put the lines in a certain slide and patient line. It tells you literally everything to do. And it also comes with a manual. So if you're not sure, you can also read the manual. So yeah, it's pretty simple.
And when you went home to first start up on the peritoneal dialysis, how confident were you that you knew what you were doing? And what was it like that first week after you were on dialysis in terms of interacting with the clinic and that kind of thing?
Yeah, so I was pretty confident when I went there. You have several training classes, and it's important for you to bring somebody with you so that they know how to use your cycler as well. So if there's days when you're sick or you just need help in general to set it up, they'll know what to do as well. And the following weeks after that, even that first week, the nurses, they call and check on you all the time. Your information gets automatically sent over to the clinic, so they're able to see your numbers and how well you did on the cycler. So the communication is very open between the nurses and yourself as far as maintaining the dialysis on the cycler.
Great. And then in terms of, so you mentioned that compared to your time when you were doing hemodialysis, you feel like you've got a little bit more energy level. Any other differences in terms of how you feel with the peritoneal dialysis on a day-to-day basis compared to hemodialysis? Any other differences?
As far as how I feel, the main thing was just the energy and the amount of sleep. When I was on hemo, right after hemo, you would come home and just sleep. I would sleep almost the whole day, absolutely no energy. Sometimes I would get nauseous. My appetite was lower when I was on hemo. So peritoneal had a lot more benefits for me, at least.
And is there any difference in terms of your nutrition plan or the way you eat or fluid restriction with the peritoneal dialysis?
Yeah, so they both have similar fluid restrictions and the nephro diet, but I'm able to eat a little bit more things when I'm on peritoneal because you get dialyzed every day, so it filters out a lot more than it would if you were on hemo every other day or just 3 times a week.
And what's it like having that catheter in your belly? And particularly because with hemodialysis, I'm assuming you had an access in your arm.
At first, I was kind of a little apprehensive about it because I was self-conscious, oh, people are going to see that I have this tube hanging out and blah, blah, blah. But actually, it's not really that noticeable because you can also purchase a PD belt, which is just a belt with a pocket in it to stick the tube in, or You could stick it in your pocket or whatever. It's really not noticeable. And I'm a small person, so you would be able to see it if it was like really noticeable. So yeah, it's not bad at all.
So not noticeable to other people. And how much do you feel it day to day once it's kind of tucked away and secured?
Not really, not unless, like I'm messing with that area or I kind of accidentally tug on it. But no, for the most part, I don't even notice it there.
And what do you do in terms of just daily catheter care to keep it clean and stuff like that?
You have to clean it daily. You keep it open and dry because you don't want bacteria to build up there. So I just clean it daily and keep it dry and make sure that the tube is not being, yanked or pulled. So you have to kind of secure it down to your body with like tape or something to keep it from hanging too low.
Okay. And have you ever had problems with dialysis, like from the machine standpoint, like where the cycler doesn't work or there's issues that you haven't been able to troubleshoot on your own? And if so, what'd you do when that happened?
Yeah, I have had issues on the cycler before. I had issues where I kept getting these drain alarms where it wouldn't drain. And so I had to stop the cycler and do manual exchanges instead of use the cycler. So if there's ever a case like when your cycler is not working properly, you can either call the Baxter 800 line and they will troubleshoot whatever's going on with your machine. Or like I said, you can use manual exchanges in place of the cycler machine.
Did they end up replacing the machine for you, or were they able to figure out what the problem was?
Usually they're able to figure out what the problem is, but they also mentioned that if there's a time when they can't figure it out, they will ship out a new machine overnight so you would have it the next day.
Okay, got it. And have you had a power outage?
I have not had a power outage yet, but in the event that we did have one, I would just do manual exchanges.
Okay, got it. And then tell us a little bit about the supplies for the peritoneal dialysis, because I know there's a lot of cases that come. How does that work in terms of getting them where they need to go in the house and that whole process?
Yeah, so the supplies are an abundance of materials that comes with this, but the company delivers the supplies to you and they will place them wherever you want them to in your house. So you do need quite a bit of space for all of the supplies because it is a ton of boxes with all of the solution that you would need for the whole month. But you do have the option of either getting stuff delivered monthly or twice a month if you don't have enough space for all of the supplies at one time.
And when they drop off the supplies, do they just leave them at your front door?
No, so for me, I asked them to bring my supplies into my basement. So they'll bring majority of the supplies into the basement. And then upstairs, I have them leave about a week's worth of supplies up here so that I have enough for the week. And then the next week, have somebody help me bring up all of the materials upstairs that I need for that following week.
So you kind of have things split up a little bit in the house.
Mm-hmm.
Are there other aspects of doing peritoneal dialysis that you wanted to talk about, or other reflections that you have relative to your experience on hemodialysis?
The only thing that I would say that I probably miss about the hemodialysis that you meet a lot of different faces, because there's a lot of people that come in and out of those centers. But the peritoneal was a life changer for me. I have a small child with special needs, so I'm able to stay home more to take care of her. And I also have an older child who's into sports and all that I have to take to and from. So it just gave me a lot of freedom to do what I needed to do during the day with my family.
That's great. I'm glad that you were able to discover the benefits of being on peritoneal dialysis and that it has freed you up during the day to be with your family and do just about anything other than dialysis, right? So
yeah, one more thing, when I was on dialysis the first time, they didn't even offer peritoneal dialysis to me, so I wasn't even familiar with that option until I was told by my grandma who was on peritoneal dialysis in the past. So I decided that I was going to do this time.
It's interesting that you mentioned that because unfortunately, there are a lot of people who are out there doing hemodialysis that don't know about the option of doing dialysis at home. And that's part of the reason why we're doing this kind of educational information in the first place, is to help spread the word. So really appreciate your taking the time out today to chat with us and share some of your insight.
Yeah, no problem. Thank you for having me.
I'm joined today by Mr. Imperial, who's been doing peritoneal dialysis. And so I'd like to say welcome and thank you for taking the time today to talk with us. Maybe you could just say a few words about yourself and how long you've been on dialysis for.
I started peritoneal dialysis in May of 2022. Prior to that, I was doing hemodialysis since February of 2022. During that time in 2022, I was still working as a software consultant, Washington, D.C., but working remotely. And then I retired in December 2022. And I've been on peritoneal dialysis since then.
We could just start out by talking a little bit about your decision to do peritoneal dialysis as opposed to hemodialysis. What were the things that were important in making that decision for you?
Firstly, it was the doctors who said, "We think you'd be a good candidate for PD because I had an active lifestyle, and PD was something that you did in the evening while you were asleep, and it didn't conflict with your morning and afternoon schedule. Also, I was feeling pretty well. I wasn't weak or anything, so that's what their plan was. Except that when I started hemodialysis, it was kind of like an emergency procedure for me because I had swelling in my legs and all that. So we started out with that, and then once that was resolved, and I went through my surgery for my catheter, and they put me on PD.
I see. So had you known about peritoneal dialysis before you had to start with the hemodialysis treatments?
Yes, even before my first transplant in 2019, when my kidneys then were already failing. We went through a series of meetings with doctors and patients, and we did meet with a lady who was on PD, and she was presenting her case just like this one, and she was presenting the pros and cons of PD, and we were pretty impressed that it was still a burden, but it wasn't that much of a burden. She was very active, she was able to travel, and we were pretty impressed with that.
I see. And what's it like for you to do peritoneal dialysis on a day-to-day basis? Maybe you could talk a little bit about that.
My routine would be, in the afternoon, I would gather my supplies, bring it up to my bedroom and hook it up, and then we'd have dinner, and then before sleeping, I'd hook up, and then go to bed and wake up the next day, and I'm done. So it's although I'm on a 12-hour PD cycle, it took some getting used to, being confined to my bedroom for 12 hours. But that tube is allows me to go to the bathroom, go to my desk, watch TV, and go to the bathroom within the 15 feet diameter. So it's not bad at all.
Yeah, so maybe you could talk a little bit more about, if you're not asleep for that entire time that you're on the cycler because of the length of your prescription, what do you do once you've hooked yourself up and the dialysis has started?
My wife and I watch movies on TV, and we read. I can do anything pretty much in the room where I'm connected. I mean, it's a pretty long tube, so I'm still walking around.
So you're not in bed the entire time then?
No.
Okay. And in terms of setting up the dialysis machine on a day-to-day basis, when you go to set up the machine and prime it and get things together, how long does that take you to do each evening?
About 35 minutes, including the prime. It's not very complicated.
And how about in the morning? How long does it take you to clean up?
Once it's done the final drain, and I take my blood pressure and my weight, 3 minutes.
So it's pretty quick in the morning.
It is pretty quick.
Okay. And what's it like to have that catheter in your belly? How much do you notice it day to day, and how do you care for it?
I hardly notice it. It's like getting used to have a tail in your stomach. But I do have it's like a belt where I tuck it in, and it's out of the way. I just have to make sure that it's sterile and clean and not infected.
Okay, so it doesn't sound like it's too much trouble for you on a day-to-day
Not at all.
basis. So how you feel day to day, because you mentioned that you did hemodialysis before. So do you notice any difference in terms of things like your energy level or how you feel day to day with the peritoneal dialysis compared to your experience when you did hemodialysis?
With peritoneal dialysis, I feel good. I don't feel weak in the morning. I don't feel weak in the evening. I feel pretty much the same. I don't feel that I'm sick. I don't feel that I have kidney failure. I feel great. When I was doing hemodialysis, it could be weakening sometimes after the hemo, but it really didn't bother me either that much. I know some people in the dialysis center, I would see them, they could hardly walk after their session, but I did not experience it.
Could you talk a little bit about the supplies that you need for the dialysis in terms of the cases of dialysis solution? How does that work in terms of being delivered to your home and where you store them?
The nurses over at Michigan Medicine, they give me a printout of the schedule of delivery. So I have an account with Baxter. It's an online account. I go in there and then they tell me you have to order your supplies before a certain date. So I go in, I log in, I order my supplies, and they deliver on the day they say they're going to deliver. One thing good about Baxter is that if I travel, then I give them 30 days advance notice as to where I'm going and where I'm staying, and they will be able to deliver the desired amount of fluid to wherever I'm going. So I did that when I went to Colorado. I did that when I went to Minnesota. My wife and I are planning to do that on an international level because they deliver almost everywhere. You just have to give them, I think the lead time is a little longer if it's international, but they deliver in Europe, they deliver in Asia, they deliver in Africa. So it's good to know. It's good to know that the logistics are there to help me.
And so when you traveled, you mentioned, for example, that you traveled to Colorado. So they'll ship the supplies to your destination, whether that's a hotel or a house. Correct. Or an Airbnb or whatnot. And then you just brought the cycler with you on the airplane?
I brought the cycler with me on the airplane. The airlines will allow me to bring it in without any charge or anything because it's some medical equipment. And I bring my other supplies, my catheter, the cassettes, and whatever other supplies I need to bring with me. So Baxter will deliver the fluid. I have to take care of the machine and the other supplies.
Okay. And then let's go back to talking a little bit about the deliveries at home. So you mentioned that Baxter gives you a date for delivery. Do they just leave the cases on your front doorstep?
No. They take it to where I store the boxes. So my boxes are stored in the basement. So the delivery man will come into the house, take it all the way down there and leave it there and give me the receipt. So they do everything.
So you don't have to really lift the cases of solution. They'll bring them into the home, upstairs, downstairs, wherever you store your supplies.
Correct.
And get that situated for you.
Correct. In the same manner, when I travel, they require that somebody accept. Somebody's there to be able to accept.
Okay, but it sounds like your travel experiences have gone fairly smoothly so far.
Very smoothly.
Great. No, I know travel's important, and so it's nice that the peritoneal dialysis gives you that flexibility to take those trips. I'm happy to hear that.
Correct.
Maybe you could talk a little bit about if you need help, either with the cycler or with other issues. How has that process been for you in terms of getting help if you need it, since you're doing your treatments at home?
Well, there's an 800 number for the PD clinic in Michigan. There's always someone to call. I've never had to call because I've never really had any problems with my cycler, but we've had power failures.
Oh, so tell me about that. What did you do?
We just had one a few weeks ago. We were out of power for 6 days. But I have a generator. So when the power went out, the cycler was still on. I guess it has some kind of emergency battery in there. It was still on, which gives me time to disconnect and cap my catheter and turn on my generator. But but without the generator, I'd have to go someplace else to connect it, or I can do a manual. I have manual bags where I can do PD without the use of the machine.
Yeah, so that's typically, that's what most people do in a power outage, is if they don't have a generator, would be to do those manual exchanges. So I'm glad that you have those supplies on hand to get through to do a power outage. Have you ever had a time where the machine has had some kind of technical problem or broken or wouldn't work properly?
No, the machine would beep if there's a kink in the line and it couldn't draw enough fluid, or there's a blockage or something, or I didn't set up one of the tubes correctly. So it would beep and it would wake me up. It would beep. If I don't do anything, it will beep louder and louder and louder.
So, and then
very smart.
Will the machine tell you what the problem is, or what it thinks the problem is?
Yes, it will tell me.
Okay.
It will tell me which tube is blocked.
Okay. And maybe you could just say a few words about your relationship with your care team in the dialysis unit. So I know when you come in for clinic, you see the physician, you see the nurses, a dietitian, a social worker. How's that relationship been for you since you've been doing peritoneal dialysis?
That relationship has been very comforting for me. I know that Jeannie, the nurse, is always there. The social worker, my dietitian, my doctor, Dr. Perlman, they're always available. I see them once a month to draw blood and to give me whatever hemoglobin support that I need. I know they're always there.
Well, I'm glad to hear that this has been a good transition for you and that it's worked out well. Is there something that you wish you would have known before starting dialysis that you have a better understanding of now after having done it for some time?
Everything I learned, they're all new, and it never occurred to me how things were done. So yeah, I'm very happy, and I'm very happy that dialysis, peritoneal dialysis, and Michigan and Baxter allows me to continue with my lifestyle pretty much, unimpeded. It's just a nightly thing. The mornings, afternoons, and evenings are all mine. So I don't have to go to any center to do hemo and that.
That's great. That's great to hear. Maybe you could tell me a little bit about what the training experience was like for you when you were learning how to do peritoneal dialysis. How long did that take you, and how complicated was it?
My wife and I underwent a 3-day training at the office, and the nurse showed us all the bags, all the supplies, showed us how the machine worked. And especially what she focused especially on was the hygiene that I needed to practice. The tubes were sterile. I had to make sure that nothing, no germs entered my peritoneal cavity. Otherwise, that would create a lot of problems. So she really did focus on that, focused on washing hands, using masks, and then of course setting up the machine, doing manual exchanges. And that was 3 days. So it really prepared us for PD.
And how, when you went home to do your treatments, how comfortable were you with doing the peritoneal dialysis when you first went home?
Pretty comfortable, because we went through it all the 3 days. I mean, she made me do the hookups and even the manuals. So I was pretty comfortable doing it.
And then tell me a little bit about, once you first got home, what did the nurses do in terms of, or how did the follow-up work after you first got home?
She came to the house. She actually came and inspected the house and made sure that the brain lines were going to the right places, and I was close to the machine, and the bags were situated correctly. So she did an inspection of our house.
Just listening to your responses to these questions, I think, are going to be super helpful and hopefully provide a lot of reassurance that PD is approachable and doable. So again, thanks for sharing your insights. That's all the questions I have. This was super helpful. I really very, very, very much appreciate your sharing your insight and your experience about what it's like to do peritoneal dialysis. And our hope is that that's going to be helpful for other people trying to make this decision.
Glad to be helpful. Thank you, doctor.